So I also deal with problems called pulmonary fibrosis. It's a kind of a group which is confusing and often depressing for the patients who get to know that they are suffering from this problem called pulmonary fibrosis. It's very difficult for them to understand that what has happened to their lungs. Is it COPD? Is it asthma? Is it allergy? But it's completely different. Because the awareness for COPD and asthma, lung cancer for that matter, is huge. Everybody knows about it, you talk about it. Not many people understand that there is a bigger problem called pulmonary fibrosis. You would be amazed to know that significant amount of people die because of pulmonary fibrosis, almost equivalent to the people for suffering from breast cancer or prostate cancer. But unlike those two problems, pulmonary fibrosis does not have a direct treatment. Now there are medicines available which slow down the progression of your fibrosis, in turn enhancing or prolonging the life expectancy. But if we say that there is some cure for pulmonary fibrosis or some medicine which can reverse the process, that's not true, that's a myth. Pulmonary fibrosis can be idiopathic, that means it has no cause, or it could be secondary to lot of other problems in your body. Lot of people would be amazed to know that even rheumatoid arthritis, a problem which affects your joints, can also lead to pulmonary fibrosis in your lungs. Pulmonary fibrosis could be secondary to radiation. It could also be secondary to constant exposure to molds or even pigeon droppings. We need you to understand that today, as a patient, we are there with you, and as a community we stand with you. Most importantly, for you to understand that this is a problem which you share with many others. If you take treatment properly in the terms of medication, this disease we can bring it to a almost near halt of progression. In case patients who are diagnosed very late and the pulmonary fibrosis has progressed to that extent that these are the patients, they also need to undergo a procedure called lung transplant. Yes, that's the severity of this problem. So, diagnosis early is the key. Getting your CT scans done on a yearly basis for people who suffer from fibrosis, having an open dialogue with your doctor, not having any second thoughts of starting the treatment once advised by your pulmonologist is the key forward. So I wish you all a very good health and pray that none of you would have to suffer from problems because of pulmonary fibrosis. Thank you so much.